The following segment is sponsored by Intermountain Healthcare.
Happy Valentine's Day. You know, and we want to keep the love and the heart all healthy, so we have our good friends here at Intermountain Healthcare. They're taking your phone calls, everything about heart health. And yeah, we want to stay healthy. We have Viet Le here, cardiac physician assistant at Intermountain Medical Heart Institute in Murray. Thanks for coming down here today.
Well, no, thank you.
And we're finding that maybe taking that kind of traditional stress test isn't necessarily the best way to find blockages, right?
Well, I think one will never get away from doing stress testing.
Sure.
It's a functional test. The problem is that there's residual risk still. All it tells us is on that day that we test whether or not we think we see blockage that's significant enough to decrease blood flow. And some people pass that portion of the test, but we haven't answered whether they have coronary disease.
Okay,
and,
so
yeah.
What do you need to do then?
Well, so at Intermountain Medical Center, we use a PET CT, and on that CT scanner, we were able to obtain coronary calcium scores. And so what that does is actually, rather than just assessing whether blood flow is going through and being blocked, we see if someone does have a risk of it by looking at disease. So the actual burden of plaque in the heart.
Right. Have you guys done some studies too?
Yeah, so recently we published, we presented at the American Heart Association back in November on one of those studies. So we took a lot of individuals who had a normal stress test, so to speak, but they still had some coronary calcium, which we identified with the CT scanner, and that's where events still occurred, heart events, heart attacks, and even some deaths. So the lesson there is, if you get a stress test, it doesn't say that you're Superman for the rest of your life.
Right.
It just means that on that day we didn't see any obstruction in the heart.
Yeah, we just need to add a little science to that, and what you guys have found through your testing.
Yeah.
Well, thank you very much. Great information, and there's tons of information you can get here today just by asking the expert. Again, they're taking your calls, and the telephone number is 877-908-0680, and on social media, just use the hashtag KUTV Ask the Expert.